Welcome to today's first Pill podcast episode. This month, we are covering 5 new drugs or digital therapeutics. In this episode, I will discuss the recently cleared first-in-class prescription digital therapeutic for major depression disorder. Over the past decade, there has been an explosion of health and wellness apps. Many of these apps track activities such as sleep or exercise, calculate calories consumed, or monitor heart rate and weight trends. Digital therapeutics offer evidence-based, software-driven intervention utilized to evaluate, diagnose, or treat specific illness, injuries, or disease and their symptoms. Currently, digital therapeutics are under evaluations for a wide range of medical and behavioral health conditions. Unlike currently available data collectors, these software applications are designed to impact individual treatment, ultimately improving patient outcomes. While digital therapeutics hold promises in complementing traditional healthcare delivery systems and potentially improving patient outcomes, they also pose new challenges. These challenges include the need for physicians to adapt to new technologies across various applications, managing abundance of data, cybersecurity risk, and resistance among the elderly due to unfamiliarity with digital platforms. Prescription digital therapeutics, PDTs, represent a subset of digital therapeutics. They are prescribed by licensed healthcare practitioners authorized to prescribe medications and devices in their respective states. PDTs are intended for use on mobile devices such as phones, tablets, smartwatches, or laptops and undergo FDA clearances via FDA De Novo pre-market pathway 510(k) clearance or pre-market approval. These applications aim to evaluate, diagnose, manage symptoms, or treat illness, injuries, or diseases as a standalone therapy and/or adjunct therapy requiring a prescription for use. On March 30th, 2024, the FDA cleared the first PDT for major depressive disorder, MDD. Depression affects a significant portion of the US population, with many individuals being partial responders to antidepressant medications. The cleared PDT is an adjunct therapy for individuals aged 22 and older undergoing conventional antidepressant monotherapy. FDA clearance was based on evidence from a recent phase 3 clinical trial called MIRAI, M-I-R-A-I. This trial evaluated the effectiveness and safety of 2 digital therapeutics, the PDT and digital sham known as the placebo, in adult subjects diagnosed with MDD who were on antidepressant therapy. This PDT utilizes CBT-based lessons and a cognitive emotional training called the Emotional Phases Memory Task. These exercises aim to stimulate brain regions, amygdala, and dorsolateral prefrontal cortex associated with depression and have shown promising results in early research. While participants using the PDT demonstrated improvements in depressive symptoms, the average change was not significantly different from those using sham app, negative 9.03 versus negative 7.25 Montgomery-Åsberg Depression Rating Scale score, and no side effects were reported. The PDT is expected to be available for download with prescription in late 2024. In addition to the PDT, there are thousands of mental health apps geared towards various mental health disorders that don't require prescription. I recommend exploring the resources provided by the Substance Abuse and Mental Health Services Administration. In their July 2023 monthly advisory article titled Digital Therapeutics for Management and Treatment in Behavioral Health, you can find comprehensive information about digital therapeutics and examples of PDT for behavioral health treatment. You can also find the link to this article in our reference section for easy access. APHA also has some tools for you. Don't forget to check out the Pharmacy Today article titled Increasing Use of Prescription Digital Therapeutics and the Pharmacy Library Digital Health section. That's wrap up our discussion on this new PDT. Be sure to visit learnpharmacist.com and enroll in the First Spill podcast to earn CE for listening. Thank you for listening. Take care.